Incontinence isn't something that you have to live with. Physical therapists can really help with the symptoms of incontinence. It doesn't just need to be pharmaceutical. When we're treating someone that has incontinence, we're first trying to figure out, when does it come on? Is it an issue with emptying the whole bladder? Is it an issue with not being able to hold in the urine? And based on our findings from our subjective, we're then going to look at the pelvis, making sure that the pelvis is in an efficient alignment. If it's off, if it's twisted, if it's rotated, if it's abducted, adducted, it can cause problems with the pelvic floor muscles. And that's going to help you kind of hold in that urine or even help you excrete all the urine. And so if that length tension relationship isn't correct in those muscles because of an abnormality in your alignment, it will cause a weakening of those pelvic floor muscles. So first we're going to be looking at that and making sure that those pelvic floor muscles can fire properly, that they are being able to relax when they need to relax, that everything's working efficiently down there. We're also going to be looking at the mobility of the bladder. So the bladder can really get stuck in different areas. It can get stuck to the back of the pelvis, meaning the back of the front of the pelvis. It can be stuck, if you're a female, it can be stuck to your uterus. There can be problems with your prostate, if you're a male. And so we're really going to be getting in there, mobilizing the bladder, making sure that it can fill all the way that it needs to, and it can also contract and empty as much as it needs to. There's no adhesions that are limiting that. Finally, we're going to be looking at all of your core muscles, making sure everything fires properly, not just your pelvic floor, which is so important for your core strength, but also what's happening around your abdomen, making sure that the real true core muscles are able to fire, which will help create that pressure that you need to either hold in the urine or to be able to excrete the urine. Physical therapy can be really effective when treating someone that has urinary incontinence.